Hi, good morning. My name is Dr. Ben Newman, and I'm a coronavirus researcher. And I'll try and use that to answer your questions. Let's go. So the next question is from either Cheryl or Cheryl. I guess depending on which side of the Atlantic you are writing from. I'm going to guess Cheryl, but that's just a guess. That's probably wrong. Um, I am writing to ask your thoughts on an article. Okay, and the article's linked below. It's from guy called Dr. J. Bhattacharya, and he's an MD, PhD, MD medicine, but a PhD in economics. And so that kind of tells you, yeah, where he's coming from. What he's trying to do. So he published a very early paper that I found useful. I read through it. It was from very early in COVID in California. It was back when we didn't know we didn't have a very good handle on how far the virus had spread, and testing was not what it is now. And so there are some big estimates in there of numbers of people that are infected in certain groups, and I think he ends up close to reality, but not quite there, and kind of misses some stuff in general. So that paper I thought had some use and it had some good data in it, and ultimately there are bigger, better studies now. But the point of that paper was that the real fatality rate is somewhere between, I think it was 0.25, like a quarter and a third of 1% is what he calculated, rough ballpark. And so, yeah, this was lower than all of the actual fatality rates that you could measure at the time. And it was based on the idea that we're missing a whole bunch of cases and that there are far more asymptomatic cases than we knew at the time, which I think is partly true and was partly, he's kind of over extrapolated his data. And now we have, much bigger, better data sets from all over the globe. And it looks as though he's off by about a factor of tenfold, which is easy to happen in science. It's not that hard to end up there, and it's not really anything to be ashamed of. But what's happened since is that he's become something of a like anti-lockdown media darling. Bless him. Yeah. And he goes on all these shows, and I think I've mentioned to somebody that it feels like when he's talking on one of these shows, it's like a guy arguing against his own conscience and just winning. Yeah, and it's really sad and bad to see, but there it is. Yeah. The other parts in the question, Cheryl or Cheryl, I think we are very much on the same page. So Cheryl's points, which are very good ones. One, the author seems to ignore any data regarding disease sequelae, which is all the things that happen after COVID-19, like the damage to the heart, like anything other than just flat out dying from respiratory failure. I would totally agree. She also states that he doesn't appear to be advocating that you go out and get it, but just advocating that it's kind of not a big deal if it does happen, and it'll probably be asymptomatic, which I think that squares with what I've seen and read about this, goofball. Yeah, there, we'll say it. Let's see. Once again, astutely, Cheryl says that I think the primary goal of this publication is to simply advocate for keeping all businesses and schools open. Yes, I would agree. That does appear to be the agenda. The way he got to that agenda is, well, who knows? Yeah, internal processes in a human are fundamentally mysterious. But it may be based on the earlier research, or the opinion may have already existed, which is what I suspect, before the earlier research was done. And I think he's been cherry picking which facts he chooses to put in the old data bank ever since then, because there's a lot more data that says that the fatality rate is somewhere around, it's higher than 1%, probably lower than 5%. I've seen 4% for areas like Texarkana, where we are, just because it's going to be based on the composition. If you have a lot of older people in an area, you'll have a higher percentage, because they have a much higher percentage chance of dying the actual risk of outright death per age group is pretty well established, and that has not changed much since early on. So if you had a colony of toddlers or something, then yeah, I think you would have like a 0.1% fatality rate. I don't know who would be tending this colony of toddlers or how you herd them, get a little sheepdog or something, I guess. But yeah, for other mixed populations, it's going to depend on who's there, how healthy they are, what's the obesity rate, what's the rate of diabetes, all this other stuff, which epidemiologists are very good at calculating and using. And frankly, that's outside my area, so I can read what they do, I can appreciate what they do, and like all the work that goes into it. And I can say that almost all of what I have read, except what, yeah, this particular wingnut says, seems to be pointing in the other direction. That the fatality rate is somewhere around, yeah, 2-3%, maybe as high as 4%, depending on, yeah, population, the way the population skews. So, okay. And then the last part, I'm not an advocate for shutdowns myself. Me either. Shutdown is like the last tool you use before civilization goes into a complete collapse. The good thing about shutdown is that it's easy to enforce, because if nobody's supposed to be out, then you can tell if somebody's doing something they're not supposed to be doing. And by keeping people in one spot, you kind of, yeah, slow down transmission, because it's, as we mingle around and do all the stuff that we got to do, yeah, that's how the virus spreads. Yeah. But, so not an advocate for shutdowns, but definitely think all forms of PPE and distancing should be utilized and done correctly. Heck yes. Because that's what PPE gives us. It's not 100% perfect, but it allows us to be in situations that otherwise would be much more dangerous. It skews the odds in our favor. It's like a lottery ticket, but you get 3 numbers free that are guaranteed to be right. And you just got to pick, the 4th one or the 5th one, depending. Yeah, I don't know. Is it a Powerball or what? That's, yeah, very much in line with what my read on the situation anyway. Yeah. So, yeah, the article's linked down there. I don't think there's anything particularly sensible in the article or that this guy has said. And in general, I don't think his opinion has a lot of validity, and generally he doesn't seem to be an epidemiologist. He's somebody outside his field trying to do a new thing, kind of, not very well, and then drawing very large conclusions from a kind of a badly done little study. So yeah, there we go. Nothing particularly useful there, and yeah, I don't know. I just wish he'd stop. Yeah. Thanks. So that's the answer. That's as much as I know. Yeah. This has been Ask Dr. Ben, and thanks very much for a very good question.